All right, thanks everyone for joining today's webinar. We will go ahead and get started as people continue to trickle in. So thank you again for joining us today on this conversation about the Affordable Care Act Health Insurance Marketplace, hosted by the Asian and Pacific Islander American Health Forum and the Association of Asian Pacific Community Health Organizations. My name is Casey Lee, and I'm the Director of Community Engagement at the Asian and Pacific Islander American Health Forum, or the Health Forum for short. We are so grateful to be joined by expert speakers today to discuss the changes in the current landscape from the recently enacted H.R. 1 and the Department of Health and Human Services Marketplace Final Rule, how they apply to the 2026 Open Enrollment Period starting this Saturday, November 1st, and anticipated impacts for Asian American, Native Hawaiian, and Pacific Islander, or AANHPI, communities. The Asian and Pacific Islander American Health Forum is the oldest national health advocacy organization serving AANHPI communities. We work closely with our national network of over 300 community-based organization partners and with national health organizations throughout the country to advance the needs of underserved communities. Before we get started, we'll be going over a few housekeeping items for today's webinar. Next slide, please. This webinar is recorded and will be posted on the Health Forum's digital platforms. We will turn off the recording during audience Q&A, and you may ask questions in our Zoom chat or in the Zoom Q&A function. Next slide. On today's call, we will hear from guest speakers from the Health Forum, Association of Asian Pacific Community Health Organizations, the National Health Law Program, Northeast Medical Services, and the Orange County Asian and Pacific Islander Community Alliance. We will also host a Q&A session at the very end for any questions for our speakers. We thank you, our partners, for tuning in today and for working tirelessly to ensure that our communities are informed about the changes to the ACA marketplace. And with that, I will now turn it over to Mia Ayer, Policy Manager at the Health Forum, to share a few opening remarks.
Thank you so much, Casey, and thank you all for joining us today. My name is Mia Ayer. I serve as Policy Manager here at the Health Forum. And as you all know, the ACA Marketplace has been critical for providing affordable access to healthcare for AA and HPI communities. AA and HPIs actually enroll in Marketplace health insurance at rates far higher than their share of the overall population. And now in 2025, in all states combined, roughly half of all Marketplace enrollees are people of color, which includes between 1.8 million and 1.9 million AA and HPIs. And as you all have seen, there have been some changes coming our way this year. For example, over 12,000 active DACA recipients from 26 Asian and Pacific countries of origin have unfortunately lost access to their discounted Marketplace coverage. But I'm grateful that our speakers today will walk you through the major items like this to pay attention to this coming year. So turning to preparation for the 2026 Marketplace coverage open enrollment period, it begins this Saturday on November 1st and ends on Thursday, January 15th of next year, 2026. And I also want to flag that certain states may have longer open enrollment periods for the upcoming plan year, so make sure to double check your state's website. But Health Forum does have a webpage detailing the timeline and process for Marketplace open enrollment for the 2026 plan year on our website. So please visit APIAHF.org for more information, and I will drop that link in the chat as well. And at the top of that page, you can also download a one-page resource on Marketplace changes that we developed in partnership with APIAHF, and that has translated versions as well with more languages to come. So we'll share that here. And if you have any questions as well about open enrollment generally or healthcare that you have throughout the webinar or that you'd like to reach out to us at Health Forum about, please contact us at policy@apiahf.org. I will also drop that in the chat. But thank you so much for tuning in today again, and I will pass back to Casey.
Thank you, Mia. It is now my pleasure to introduce Adam Carbolito, Director of Policy and Advocacy at the Association of Asian Pacific Community Health Organizations, or APCHO, to share a few opening remarks. Adam, I'll pass it to you.
Thank you, Casey, and Hafide, and hello, everyone. As Casey mentioned, I'm Adam Carbolito with APCHO, the Association of Asian Pacific Community Health Organizations. For those of you who may be unfamiliar, APCHO is a national nonprofit association of community-based health provider organizations, mostly federally qualified health centers, that works to improve healthcare access and outcomes of Asian Americans, Native Hawaiians, and Pacific Islanders in the United States, the U.S. territories, and the freely associated states. We thank you for joining today's webinar and appreciate our close partnership with the Health Forum to host this important dialogue as open enrollment for the ACA marketplace opens this weekend and individuals begin enrolling in health insurance coverage for 2026. We hope that today's discussion will help ensure that our communities, and importantly, the community-based organizations that work with them, are informed of recent changes to federal policies and how we can work together to protect the gains of improving healthcare for Asian Americans, Native Hawaiians, and Pacific Islanders since the ACA's passage, especially in light of the current healthcare environment. I would be remiss, however, if I didn't acknowledge the challenges we face as steep cuts to safety net programs begin to take effect. ACA tax credits have not been renewed by Congress, new eligibility and verification requirements come online, and the ongoing federal government shutdown stokes uncertainty for programs many in our communities rely on. For community health centers, the impact is dire. 100% of federal support remains frozen until Congress passes health centers' annual appropriations and reauthorize the health center program as well as health workforce programs that are critical to supporting patient care. Additionally, we've seen that public sentiment of the healthcare system is uncertain. APCHO recently conducted a national poll of Asian Americans, Native Hawaiians, and Pacific Islanders. About 1 in 5 said they were afraid they were going to lose health insurance coverage in the next year, and about half did not feel they had enough information about recent federal policy changes to understand how it would impact them or their families. While these numbers are still preliminary, as we analyze the data, they tell a distressing story of the current state of the public health system and fears within our communities that make it harder to get care our families need. I hope today's webinar is a step towards addressing that uncertainty. I'm excited to hear from our panelists who will explain how recent changes to federal law and regulations will impact eligibility, enrollment, and affordability, as well as how healthcare providers and community-based organizations are working to alleviate fears, educate communities, and enroll patients so that they can continue to get the care they need. Thank you again for joining today's conversation. Casey, I'll turn it back to you to get us started.
Thank you so much, Adam, for sharing APCHO's work and perspective on this critical topic. I'm now pleased to introduce our first guest speaker, Geraldine Detzer, a senior attorney at the National Health Law Program, to cover the impacts from HR 1 and the HHS final rule on ACA marketplace coverage and enrollment, including when changes take effect. Geraldine, thank you for joining us today.
Thanks so much. Casey and team, I am really honored to join you all today to talk about the many changes to ACA marketplace coverage coming from the federal government, including changes originated in Congress, the White House, and the courts. My name is Geraldine Detzer. I'm a senior attorney at the National Health Law Program. And if folks aren't familiar with NHeLP, just a little bit about our group. We're a national nonprofit legal and policy advocacy group committed to using litigation, legislative and administrative advocacy, technical assistance, and education and outreach to improve healthcare access, equity, and quality for underserved individuals and families. We count state and local partners in all 50 states, the District of Columbia, and Puerto Rico. And I encourage you to go to healthlaw.org to sign up for our Health Advocates listserv and read our equity stance. You can also find us on Blue Sky, Facebook, and LinkedIn. Our comms team keeps those feeds fresh with new resources almost every day of the week. So, over the course of really just a couple of months this year, we have seen some major legislative and regulatory changes to ACA marketplace coverage. I only have about 15 minutes to spend with you today, so we won't be able to dive into the details of the literally dozens of sometimes very technical changes brought as a result of laws and reg changes. So I'm going to focus on orienting us with the 3 major vehicles for coverage change and do my best to explain how these vehicles interact, overlap, and in some cases conflict with each other, and really how these changes affect people with marketplace coverage. The first major change came out in June of 2025 when the Centers for Medicare and Medicaid Services, part of the Trump administration, published what I'm going to call the Marketplace Final Rule. This was a major regulatory change with effective dates beginning in August of 2025, but continuing through the full 2026 plan year. Almost as soon as it was published, it was challenged in federal court and is now the subject of two distinct federal lawsuits, which I'll talk about in detail on the next slide. Just days after the Marketplace Final Rule was published, the Senate passed and the president signed the One Big Beautiful Bill Act, or OBA, enacted on July 4th of 2025. It has effective dates for changes to marketplace coverage that begin in January of next year, go through 2027, and have additional changes in 2028. This bill did not just affect marketplace coverage. As many on this call likely know, it makes over $1 trillion of cuts to Medicaid, marketplace, and food stamps. Although we're focused on marketplace coverage today, if you have Medicaid questions, I encourage you to check out NHeLP's many resources on OBA and Medicaid defense. Finally, last but definitely not least, as we're looking at the start of open enrollment in just a couple of days, Adam mentioned that the enhanced premium tax credits are set to expire on January 1st of 2026. This could have really disastrous affordability effects for millions of people with marketplace coverage. So I mentioned that there are two federal lawsuits focused on the marketplace rule. I'm going to talk about these lawsuits. I want to clarify that they don't touch the One Big Beautiful Bill Act, and they don't affect the enhanced premium tax credit issue that's driving the shutdown right now. These are just focused on the Marketplace Final Rule. Two sets of plaintiffs have sued CMS to halt implementation of the Marketplace Final Rule. The first set of plaintiffs are a group of big cities led by Columbus, Ohio, and the second a coalition of 21 states led by the California Attorney General's office. Both sets of plaintiffs argued to their separate judges that the rules would be so detrimental to them and to their constituents that the judge should stop implementation of the final rule while litigation was progressing. This is called a preliminary injunction, and they're looking for a pause or partial stay. In August of 2025, just a couple of days before the rule would have been implemented, the judge in the city of Columbus partially agreed with those plaintiffs and halted about half a dozen of the rule's 17 separate provisions. Unfortunately, just a few weeks ago, the judge in the California case disagreed and rejected the request for a preliminary injunction. So that's confusing. What does it mean? Fortunately for consumers, the Columbus stay or pause was a national injunction. And so that means that 7 of the rule's 17 provisions will not go into effect this year and will likely not affect open enrollment in 2026. Litigation is continuing. Federal litigation often takes months or more to be resolved and will ultimately determine the final outcome of all provisions. So we live in a sort of state of suspension and uncertainty until that happens. And additionally, CMS will continue to put out new regulations about the marketplace, even though there's litigation on this one specific regulation that's tying things up. In particular, folks who follow federal regulatory changes should look in late this year or early next year for CMS's traditional annual rulemaking on marketplace coverage. That's something NHeLP will certainly cover. We're happy to work with you if you're looking for advocacy opportunities around new marketplace rules. I want to mention, and this is going to be a theme over the next several slides, that regardless of the final outcome of the litigation and the regulations, there are permanent OBA policies that change the underlying law and often drive similar or broader consumer harms. So this ties together those vehicles that I was talking about in the earlier slide, the regulation and the legislative change through OBA. But the impacts of the federal policy changes should really start, particularly this week, with the discussion of the premium tax credits. So since 2014, the Affordable Care Act has offered premium tax credits to reduce the cost of insurance for people buying marketplace coverage. In 2021, Congress made those premium tax credits more generous and expanded the population eligible by getting rid of an income cap that had previously been at 400% of the federal poverty level. Because Congress has not acted to extend those enhanced premium tax credits are set to return to those 2020 and earlier levels on January 1st of next year. KFF has estimated that if this takes place, then the average consumer will pay more than double the premium that they had been paying last year for the same coverage. That's on average. There are some populations that are likely to pay even more, including very low income people who have had access over the last few years to $0 silver or mid-level premiums. That opportunity will go away and they will be charged for coverage. Separately from the premium tax credits, and even if Congress does resolve this issue before the end of the year, changes under OBA and the Marketplace Final Rule will still make marketplace coverage more expensive, harder to get and maintain, and less comprehensive. The Congressional Budget Office has estimated that if all of these changes go into place, EPTC expiration, OBA, and all of the provisions of the Marketplace Final Rule, 7 million more consumers will go uninsured. So, diving into the details a bit, I said that the marketplace changes will make coverage more expensive. Of course, if premium tax credits are not extended, that will have a direct and dramatic effect on premium costs for next year. That is the primary policy cause of the current government shutdown and has been the issue that the media has been focused on. But the marketplace rule and OBA will also make coverage less affordable and certainly less accessible, particularly for low-income groups. They do this in different ways. Regulations tend to be sort of smaller scope, more technical. The marketplace rule has different implementation dates, and some policies are even temporary. But if you compare pieces of the marketplace rule to pieces of OBA, you'll see that they really work hand in hand. And one example of that is how the marketplace rule temporarily paused the low-income special enrollment period. This was an enrollment opportunity for people with incomes below 150% of the federal poverty level to enroll in coverage year-round. The marketplace rule got rid of it effective August 25th of 2027 through the end of next year, but claimed that states and healthcare.gov could bring it back in 2027. But when you compare that provision of the marketplace rule to the special enrollment period provision of OBA, you can see that the marketplace rule is really a bridge to permanently ending a low-income special enrollment period as an opportunity for folks to get coverage. And that's because OBA permanently disallows premium tax credits for individuals who enroll via any income-based special enrollment period. And that change goes into effect in January. Of course, if people are in that low income range, enrolling in coverage on paper is not going to be enough. They need premium tax credits to make that coverage affordable. So the marketplace changes also target lawfully present non-citizens. As mentioned earlier, the marketplace rule excludes DACA recipients from coverage. That went into effect at the end of August of this year. OBA, as I was talking about in the last slide, really targets premium tax credit eligibility. It does so in two phases. Beginning January 1st, lawfully present immigrants earning less than 100% of the federal poverty level who are ineligible for Medicaid due to their immigration status will no longer be eligible to receive premium tax credits. And next year, starting January 1st of 2027, many lawfully present immigrants over 100% of the federal poverty level will be excluded from premium tax credits, leaving only green card holders, some Cuban and Haitian entrants, and people residing lawfully under a COFA agreement eligible for premium tax credits. Folks here on humanitarian status, including refugees and asylees, people who have visas related to being survivors of domestic violence or human trafficking, all of those folks will no longer be eligible for premium tax credits. And again, we know that that means for most people, their coverage will not be affordable and therefore not accessible. The marketplace changes also add red tape and rescind efficiencies that made it easier for people to get and keep coverage. Again, on the marketplace side of the slide, you'll see there's lots of smaller, more technical changes. The ones that I've italicized and flagged as being stayed are the ones that the plaintiffs in the City of Columbus case successfully argued should be paused while the litigation works its way through the courts. That's great for this year, and it is important protection for consumers. But again, the stay is temporary, pending the outcome of litigation. And to continue on my theme, if you connect the marketplace changes up with similar changes under OBA, you'll see that the statutory changes under the One Big Beautiful Bill Act often almost swallow up these smaller regulatory changes with similar effects. So another example of this is that under the marketplace rule, and a provision that has been stayed for now, so it's not happening in this open enrollment, people with incomes under 150% of the federal poverty level who had $0 plans would not have been able to automatically re-enroll in their coverage without taking steps to additionally verify themselves. But under OBA, all consumers with premium tax credits will be required to take additional verification steps, effectively ending the practice of automatic re-enrollment for the 2028 plan year. This is going to be a really significant shift. It's down the line. It's not our most immediate concern. But since 40% plus of enrollees relied on automatic re-enrollment this year, and in some states it's closer to 75%, this is going to be a major shift with big risks for people who are not actively involved in the re-enrollment. And finally, the marketplace changes make coverage less comprehensive. So effective January 1st, the marketplace final rule prohibits issuers from covering what they refer to as sex trait modification procedures, otherwise known as gender-affirming care, from being covered as an essential health benefit. Issuers can still choose to cover these services as non-EHB, but that would mean that premium tax credits and cost-sharing limits wouldn't apply, increasing their cost to the consumer. States can also still require these services as non-EHB, but, and this remains to be seen, that could trigger what are known as defrayal requirements, which adds cost to the state itself. We're not sure how CMS is going to interpret its own rule, even how they're going to enforce the rule. So this is an issue that NHeLP is following closely. My last couple of slides are what I call just an implementation snapshot. I really want to emphasize that things can change on a dime, as we've seen major policy changes coming through very quickly this year. And especially when you get litigation into the mix, the changes can be rapid and confusing. So this is really just an attempt to say, here we are today. So the marketplace final rule, as you can see, introduces many folks who are, many changes that are going to be impactful. Some are temporarily stayed. I've tried to flag that on the left side of the screen. Others are currently in effect, but regardless, many will be affected, many will overlap with the OBA statutory changes, as I've mentioned a few times during this presentation. And finally, here's a similar illustration of how the select marketplace provisions of OBA will come into effect, beginning January 1st of 2026. I've included the expiration of EPTCs on this chart, even though we all know now it's not really part of OBA, but it is a statutory change and it is expected to come into effect January 1st of 2026. That concludes my part of the presentation. I am sure I'm at, if not over, time, so I'm going to turn it back to Casey.
Thank you so much, Geraldine, for sharing your expert insights and explaining all the various changes between the legislative and regulatory updates to the marketplace and the various states of play. And a reminder for participants, please use the Zoom chat or Q&A function if you have any questions for our panelists, and we will try to get to them during audience Q&A at the end. And I will also share a resource that Mia mentioned earlier about the Health Forum's Marketplace webpage in the chat shortly. Now it is my pleasure to introduce Jim Tai from the Northeast Medical Services, a member organization of APCHOs. Jim, thank you so much for joining us today. We look forward to learning more about the Northeast Medical Services and the work you're doing on the provider side and implementation and education for your patients, staff, and communities when it comes to California's Health Benefit Exchange, Covered California. Jim, the floor is yours.
Hi, my name is Jim Tai. I am from Northeast Medical Services. A little bit about us. Northeast Medical Services have been serving community for nearly 60 years now. We began as a small medical clinic in San Francisco, Chinatown area, and have since grown to more than 32 clinic sites with about 250 providers, serving throughout 3 different counties: San Francisco, San Mateo, and Santa Clara County here in the Bay Area. Over the year, we have expanded our services to include medical care, dental, behavioral health, optometry, ancillary services, and integrative medicine such as acupuncture and chiropractic care. I am part of the member services department, and our primary focus task daily is registering new patients who are interested in using any of our services. We also assist eligible community members with enrollment into purpose-sponsored programs such as Medicare and some Cover California. Today, I'm here to share how our organization, in terms of our department, is working to increase Medicare patient awareness on enrollment during this critical periods. The challenge that we're experiencing in the face of policy change, especially with this HR1, and how our community is reacting to this change. I'll highlight a bit about how we are supporting our community through the proactive outreach and education. As many of you know, this one big beautiful bill is about to undergo some of the biggest policy change that we have seen in a long time. This change taking effect over the next 1 or 2 years are already causing confusion, fear, and misinformation in the community. That's why we are focusing heavily on outreach and multilingual education during this critical time. One of our recent strategy has been the production and broadcast of a series of 5-minute education videos. These videos are aired regularly on a trusted Bay Area TV channel that's serving Asian community. Each video focuses on specific topic, focusing with the change to Medicare and what the individual and family need to do now to protect their coverage in the near future. Some of the list, a little bit detail of the videos that we create. First, we inform the undocumented adult aged between 19 and 59 that starting January 1st, 2026, new application for this Medicare will be frozen for this group. That means the last day to apply is December 31st, 2025. We are encouraged everyone who may qualify to enroll now so they can retain coverage, assuming they continue to meet eligibility. The freeze applies only to new applicants, so if they are enrolled before the cutoff, they can continue their coverage. We also focus on reminding them that it's important to complete the renewal package in time to avoid interruption, because the new rules say that all renewal need to complete within 90 days. All benefit will be terminated. For those who does not have a legal document may not be re-enrolled after 1/1/2026. Secondly, we are providing important update for the senior and individual with disability, especially those in the non-Magi medical group. Starting of 1/1/2026, those applied or renew will need to meet access limits of 130,000 for individual or with an additional 65 grand for each added household member. Advise they plan ahead and look into their access amount and spend down if needed before 1/1/2026. Third, we also educate a community that starting July 1st, 2026, Medicare will no longer cover dental services for many adult members, especially on the undocumented population. All those green card holders under 5 years won't have dental coverage starting 7/1/2026. Lastly, we also warning the community about the work requirement exclusions that will begin in 1/1/2027. That adult 19 to 64 will need to prove that they are working, going to school, or perform community service for at least 80 hours per month in order to remain eligible for Medicare. So at each of this end of the video, we always remind the audience to make sure to renew their package when it's due to renew and contact us if they need to have any assistance. While we are doing our best to educate and support our patients, we are encountering significant barriers, many of which generate from this new rule change related to federal policy. The policy change has created anxiety across our community. We are seeing an alarming trend, such as eligible individuals are choosing not to enroll, or worse, asking to be disenrolled because of the fear of the misinformation. Some of the concern we are hearing since I think July till now is if I enroll into Medicaid, will it affect my green card application? Will they share my information with immigration? Or was told that they won't be able to return to U.S. from out of country travel due to records showing that they were on public sponsored programs such as Medicaid? Or even can I be deported if I'm on public benefit? Even among those who are here legally, such as tourists, new green card holder, or long-term visa resident, there's a deep mistrust. This is especially true in the Asian community that we serve, where many families are mixed status or have complex immigration history. Despite our outreach and assume that healthcare enrollment is not considered a public charge, the impact of this policy change and media narrative around the immigrations are hard to overcome. We are experiencing that our team also stressing real thin because of this new rule. It take longer to explain eligibility, answer question, and process documentations. We are seeing more no-show or for appointment or more call from patient who simply doesn't want to do it anymore. My summary is to miss this moment, we create a comprehensive strategy that includes video outreach. In addition to our TV outreach on the series of videos, we are currently also producing a new video that includes QR code link to show step-by-step guide for completing Medicare renewal. This goal is to make sure renewal process feels less overwhelming. This is particularly helpful for working adult and caregiver who may not have time for a full appointment, but can watch a video at home in their own language and then follow a simple link to get help. We also adopt in a walk-in enrollment support. We designate at least one staff per site who entire schedule is blocked off each day for drop-in support. This will allow us to immediately assist patients who are confused, anxious, or up against a deadline without asking them to come back another day. We're seeing a great success in this model. Not only does it prevent coverage gap, but it builds trust. Patients know that they can get real-time help, not just a flyer or a phone number. All material are begin translated into multilingual and written in plain language. We are lucky to have a team who are bi or multilingual, and many come from various communities we serve. This has made a big difference in helping patients in our community. And thanks again for the chance to share with you our experience. I'm happy to take any question and answer it afterward.
Thank you so much, Jim, for sharing your insights and perspectives with us and for the critical work that the Northeast Medical Services is doing in delivering affordable, compassionate, and quality healthcare for your community members and also through your various education and outreach efforts. Now I'm excited to introduce Sivani Lee, Health and Policy Director from the Orange County Asian and Pacific Islander Community Alliance, to share OCAPICA's own efforts and stories related to these policy and community impacts. Sivani, thank you for joining us today, and I'll turn it over to you.
Thank you so much, Casey. And thank you so much, Jim, for that great presentation you just had. Hi, I'm here to speak about the local impact the Affordable Care Act changes has had to the Asian American and Native Hawaiian Pacific Islander communities here in Orange County, California. My name is Savani Lee. I'm the Health and Policy Director at OCAPICA. The Orange County Asian and Pacific Islander Community Alliance was founded in 1997 and focused on research, advocacy, and education around issues of health within Asian American and Pacific Islander communities. By 1999, OCAPICA expanded to include legislative education and advocacy, as well as youth, cultural arts, and curriculum development. Since then, OCAPICA has grown even more to respond to the needs of Asian Americans, Native Hawaiian, Pacific Islanders, and other underserved communities, expanding its programming and mental health and wellness for youth and families, civic engagement and voter empowerment, youth employment, and academic mentoring and college readiness. OCAPICA also partners with local area universities on research, evaluation, and service learning. This slide gives a snapshot of OCAPICA's impact and the range of services we provide to the community. While these numbers are from last year, they reflect the breadth of our work and commitment to serving the whole person and the whole community. In mental health, OCAPICA runs the largest API mental health program in Orange County. Last year alone, over 37,000 community members were reached, with the vast majority connected to mental health supportive services. In health, we lead the Orange County API task force of 12 organizations to provide COVID-19 outreach, reaching more than 918,000 people. Importantly, nearly half of those reached were connected to direct supportive services. Our housing work was prevented over 450 individuals, more than 100 families from experiencing homelessness. And with our youth programs, we're proud that 100% of our youth fellows went on to a four-year university and all increased their GPA through our program. In policy and civic engagement, OCAPICA served as the regional lead for Stop the Hate in Orange County and the Inland Empire, delivering programs and funding to partners while reaching over 10,000 residents through nonpartisan voter engagement. And while our workforce development program has since sunsetted, it successfully helped over 475 participants complete work readiness training and achieve 100% job placement at the time. Taken together, these numbers show how OCAPICA works across multiple systems, health, housing, youth, and policy, to ensure that our communities are not only supported, but empowered to thrive. This slide shows the ways that we've been working on healthcare access, which is at the core of our work. Advancing narrative impact is one of our strategies, and we know that stories are powerful in shifting policy conversations. That's why we elevate client stories with our elected officials and in hearings in the California State Legislature. Sharing lived experiences helps decision makers understand the real consequences when healthcare access and language needs are unmet. Protecting and navigating families, we co-sponsored California Legislative Bill AB 1242, the Language Access for All Bill, along partners like Asian Health Services, Bay Area Regional Pacific Islander Task Force, Asian Resources, Inc., and Center for Asian Americans in Action. This legislation seeks to ensure language access across state agencies so families can navigate health and social systems without being excluded because of language. We also uplift coalition and network resilience. We recognize we're stronger together. We co-lead and participate in several statewide coalitions, like the California Movement Solidarity among AAPI communities, also known as Mosaic, the California AANHPI Health Equity Coalition, and serve as the regional OCIE lead for California Stop the Hate. By engaging with state coalitions, we've been able to build broad-based support. We also work on base building for service impact. Beyond coalition work, we've been with our staff and within our communities to base build our clients and our community partners to prepare and understand the needs of our clients and gain support for our impacted services. California's ACA marketplace recently announced the first double-digit rate increase since 2018. Californians who get their health insurance through the state's marketplace will see premiums increase by an average of 10.3% next year. Rising healthcare costs, the expiration of enhanced federal subsidies, and policy-driven market uncertainty together are fueling the hike. Insurers in recent years have expected healthcare costs to increase by about 8% each year. That makes up the bulk of next year's increase. But analysts and KFF say that 2% of the rate increase in California's version of the Affordable Care Act marketplace is based on federal financial assistance that expires at the end of this year. OBA also left out funding for enhanced premiums tax credits, as was shared earlier, that use by more than 90% of the ACA enrollees nationwide. State officials recently took steps to ease the potential loss of federal subsidies for the lowest income covered California members. The state will spend $190 million to maintain subsidies for people earning up to 150% of the federal poverty level. This includes individuals earning about $23,000 or families of four earning about $48,000. Still, that investment is far short of the $2.1 billion the state stands to lose. Covered California's previous estimates indicate that 600,000 people could drop coverage as a result of lost subsidies and rising costs. That in turn could make health care even more expensive. How is OCAPICA, our organization, responding? We've held press conferences with our local congressional members on the impact of HR 1 and currently the federal shutdown. Everyone has heard about the ICE rates that have been impacting Southern California. This has impacted healthcare access at OCAPICA and our clients. Sorry. OCAPICA is also a Medicaid provider for behavioral health services, health navigation, and housing navigation services. Many of our clients have requested for telehealth or services by phone. These experiences, both a community-based organization and direct service provider, have put us on the forefront of participating in coalitions to advocate for defending the social safety net, including sharing disaggregated data information about the impact of the Medicaid cuts and the SNAP cuts to our clients. Most recently, we joined a statewide coalition, Can't Stop California, which is working on election protection and voter rights for California's upcoming election on redistricting. I wanted to share with you a Samoan proverb. I'm not going to try and pronounce it, as I will probably butcher it, but this slide highlights our strategy and leading with community partnerships. We help participate and strengthen partnerships across the Asian American and NHPI serving organizations to foster collective impact. Within coalition spaces like the OCAPI Task Force and the Health Equity Coalition, community members we serve are always elevated as a cross-cutting priority. By aligning efforts, we ensure communities' social service needs are not siloed but integrated into broader policy conversations. And I would be remiss if I did not name or acknowledge one of our champions and community leaders who is on today's Zoom, Auntie Jane Ka'alapang. She's the co-founder of Pacific Islander Health Partnership. PIP is also one of the key organizations working with OCAPICA and the Health Forum on information sharing in Pacific Islander languages around the impact of HR 1 and the increased tax premiums around the ACA. Together, these strategies reinforce the healthcare access is not an add-on, but a foundational part of advancing health across all areas of our work. Thank you so much, and I'll be happy to share links in the chat. Thank you so much.
Thank you, Savani, for sharing all about OCAPICA's incredible work and in your serving and educating your communities in response to all of these different changes. We will now transition into audience Q&A. Our Health Forum staff will now pause the recording of today's webinar for this portion. With that, I see we are at the top of the hour. So Geraldine, Jim, and Savani, on behalf of the Health Forum and APCHO, thank you so much for sharing your insights and time with us today for today's webinar. And thank you also to all our attendees for joining us. We will send out all the mentioned resources after this call. And once again, thank you again for joining us today and wishing everyone a great rest of their day.